So normally the current is flowing towards lead 1 and towards lead 2 and towards lead AVF. Is that right? A point between lead AVF and lead 1. The normal direction of cardiac access is between these two leads. Now we can determine the axis of the heart by looking at the QRS complexes in the lead 1 and in lead AVF. You can use lead 2 in place of AVF as given in the Plab keys, but the standard method is we can calculate or assess the cardiac axis between lead 1 by looking at the QRS complexes in lead 1 and QRS complexes in lead AVF. Now, if the current is flowing towards a lead, if the current is flowing towards a lead such as lead 1, it will produce a positive QRS complex. And if it's flowing towards AVF, it will produce a positive QRS complex in lead AVF. So remember the two basic principles. If the current flow towards a lead, it will produce a positive QRS complex. And if it flows away from the lead, if the depolarizing current flow away from the lead, then it will produce a negative QRS complex. Remember these two principles and you will never get the answer of an axis deviation wrong. So now let's suppose that we saw the lead AVN, we saw the lead 1. If the current is flowing towards a lead, it will produce a positive QRS complex. And if the current is flowing away from the lead, it will produce a negative QRS complex. So now we are looking at an ECG. We are looking at lead 1. In lead 1, the QRS complex is positive. And in lead AVF, it is positive. In lead 1, if the QRS complex is positive, it means the current is flowing towards AV lead 1. And if the QRS complex is positive in AVF as well, then it means the current is flowing towards AVF. So the cardiac axis is between 1 and AVF, somewhere between these 2 points. So if both of the QRS complexes are positive, then it means the cardiac axis is normal, right? If the QRS complex is positive in both lead 1 and lead AVF, then it means the current is flowing in the normal direction, because normally the current flow towards lead 1 and AVF or lead 2, because lead 1 is towards the left and lead AVF is downward. So it means normal cardiac axis. Now the QRS complex is negative in lead 1. QRS complex is negative in lead 1. It means the current is flowing away from the lead 1 in this direction. The current is flowing in this direction. Because the QRS complex is negative in lead 1, it means the current is flowing away from the lead 1. And QRS complex is positive in the AVF. So it means the current is flowing in the direction of AVF, but away from the lead 1. So the direction of the axis is somewhere between this line and this line. So what we will call it as right axis deviation or left axis deviation. QRS complex is negative in lead 1. QRS complex is negative in lead 1, right axis deviation. Excellent. It's very simple. You just have to look at the QRS complex and determine the direction of the current with respect to lead 1 and AVF. So QRS complex is negative in lead 1. It means current is flowing away from lead 1 in this direction, not towards lead 1 in this direction, away from in this direction. And QRS complex is positive in AVF, so current is flowing towards AVF. So the cardiac axis is between this point and this point, and it means normally the cardiac axis was here, so it is deviated towards the right, and we call it as right axis deviation. Now, again, let's look at the lead AVF. The current in lead AVF is, or the QRS complex in lead AVF is negative. What does a negative QRS in AVF means? A negative QRS in AVF for lead 2 means you can use lead 2 in place of AVF according to the Plab keys criteria. So the QRS complex is negative in AVF. What does it mean? It means the current is flowing away from the AVF in this direction, in upward direction, right? And QRS complex is positive in lead 1, so it is flowing towards lead 1. So now the axis is somewhere between here and here, which is what? So the axis is deviated towards left. The axis deviated towards left. Yes. Now we look at lead 1. The QRS complex is negative in lead 1 and negative in lead AVF. Now tell me, where will be the axis of the heart if both of them, if QRS complex in both the leads, lead 1 and AVF is negative? What does it mean? Where the cardiac axis lie if both of the QRS complexes are negative? Tell me the angle. Yes, extreme axis deviation, because let's see the diagram again. QRS is negative in 1, so current is flowing in this direction. It is negative in AVF, so current is flowing in this direction. So the axis will lie between here and here, between 180 and minus 90. So we'll call it as extreme axis deviation. So I hope the normal cardiac axis and the left axis deviation, right axis deviation, and extreme axis deviation is clear to both of you. If you want any question, yes. Yes. Yes, location of the leads, I'll tell you in the next slide how to memorize the location of the leads. For now, just remember this circle. And remember that lead 1 is on the left side and lead AVF is on the inferior side on the left foot. Just remember this circle. You do not need to remember the thumb rule if you remember this diagram. Thumb rule is basically a cramming for excess deviation. But this method is very easy if you make your concept clear. Just remember this circle and remember that lead 1 is on the left side and lead AVF is downward or lead 2 is downward. And the next thing that you have to remember is that if the current is flowing towards a lead, it will produce a positive QRS complex. And if it is flowing away from the lead, it will produce a negative QRS complex. So by remembering these two things, you can assess the cardiac axis easily. Now let's do some examples. So again, the circle here is minus 90, here is plus 90, here is 0, here is 180. You can just remember only these four angles. So lead 1 is positive. Lead 1 positive means current is flowing towards lead 1. Here is lead 1. Lead AVF is positive. It means current is flowing towards lead AVF. So the cardiac axis is normal between lead 1 and AVF. Now in lead 1, QRS complex is positive. Positive means current is flowing towards lead 1 here. And AVF, it is negative. It means it is flowing away from the lead AVF because AVF is at the bottom. So it is moving upward. So the cardiac axis is between 0 to minus 90. So it is left axis deviation. And similarly in the other two examples. Now for Plab 1, the causes of left axis deviation and right axis deviation that you have to remember is that the most important cause of right axis deviation is lateral wall MI. Lateral wall MI causes right axis deviation. If you want me to explain how lateral wall MI can cause right axis deviation, I can explain that too. And inferior wall MI cause left axis deviation. Inferior wall MI causes left axis deviation. Okay, let me explain it to you by showing you another diagram. Just give me a minute. So as I have told you that, remember that a dead tissue is a depolarized tissue. So this is the lateral wall of the heart. This one on the left side is lateral wall of the heart. And as an MI has occurred in the lateral wall, it means the cells in the lateral wall, the myocardial cells in the lateral wall has died. The cells in the lateral wall has died. So the current will flow from left to right because the muscle cells, because they are dead, they are already depolarized. So the depolarizing current will flow in this direction from left to right, like this. So here is lead 1. So the current is flowing away from lead 1. And here is lead AVF. And AVF is downward and the current is also going in the downward direction. So that's how lateral wall MI causes right axis deviation. I hope how lateral wall MI causes right axis deviation is clear to both of you. Now in inferior wall MI, Dr. Pascaline, is it clear? Thank you. Now in inferior wall MI, there is infarction of the inferior wall. Infarction of the inferior wall. So in inferior wall MI, the current will flow upward away from AVF because AVF is inferior. So the current is flowing away from AVF in this direction. And as the lead 1 is already upward, so it is flowing towards lead 1 and away from AVF in inferior wall MI. So the cardiac axis will lie here. So the inferior wall MI will cause left axis deviation. So now you know that how inferior wall MI and lateral wall MI can cause axis deviation. If you know the location of the leads and the flow of the current, then you can easily tell that you don't need to cram it. You just can tell by just remembering the direction of the current. Now, what happened in the left bundle branch block? In left bundle branch block, now let me tell you. Yes, where's the MI, the current will flow opposite because as I told you that the dead cardiac tissue is depolarized cardiac tissue. Yes, dead tissues are depolarized, so that's why they are already depolarized. So if the lateral wall MI, the lateral wall is already depolarized. It does not need any depolarization. So the current that is coming from SA node will depolarize the right side of the heart. That's why the direction of current is towards the right. Because the coming current will depolarize only the right side of the heart. Now, now can you tell me in left bundle branch block, which deviation, which sided deviation will occur? In left bundle branch block, which sided deviation will occur? Can any one of you tell me? In left bundle branch block, which sided deviation will occur? Excellent. Right side deviation in left bundle branch block, sorry, not right deviation, right sided deviation. Let's see. Let me give you an example. The current starts from SA node, then it goes to AV node, then it goes into left bundle branch block, sorry, left bundle branch and right bundle branch. So if there is left bundle branch block, the right side of the heart will be depolarized first. the right side of the heart will be depolarized first, right? In the left bundle branch block, the right side of the heart will depolarize first. Is that right? Because the left bundle branch is blocked, so the right side of the heart will depolarize first. Is that right? And the left side of the heart will be depolarized. Yes, and the left side of the heart will be depolarized after. So the direction of the current will be from right to left, because the right side has been depolarized first and the left side is depolarized after the right side, because of the slow speed of depolarization because of left bundle branch block. So in left bundle branch block, there will be left axis deviation, because the direction of current will be from the area which are depolarized first, like in ischemic tissues, the area which are depolarized first, the current flow from that area to the area that are depolarized later. So that's why in left bundle branch block, there will be left axis deviation. Is it clear? Yes, it will be left axis deviation in left bundle branch block. Now what will happen in left ventricular hypertrophy? In left ventricular hypertrophy, the left-sided muscles or left side of the heart will become large and the right side of the heart will be small. So which portion of the heart will be depolarized first, right or left, in left ventricular hypertrophy? Left side of the heart is large and right side of the heart is small. So which will become depolarized first, the large one or the small one? The right side will take less time or the left side will take less time to depolarize? The smaller muscles will take, yes, the smaller area will be depolarized first. And the smaller area is right side of the heart. So right side of the heart will depolarize first and left side of the heart will be depolarized. Yes. So again, which axis will be deviated towards right side or toward left side? In which direction the current will flow? From the direction of the area which is depolarized first to the direction of the area which is depolarized later. So in left ventricular hypertrophy, axis will be deviated towards which side? Left side. Excellent. Dr. Sarat, is there any confusion? Okay, let me clear the confusion. The area which depolarizes first, the current will flow from the area which depolarizes first to the area depolarize which depolarizes later. This point is clear. No confusion in this point. Now imagine that there is hypertrophy of the left ventricle. The left ventricle has become enlarged. The left ventricles are large. Because they are large, their size is increased, so they will take more time to depolarize. Is that right? And right ventricle will take less time to depolarize. Is that right? Because the right ventricle is small, so it will take less time to depolarize. So which area will be depolarized first? Right side or left side? Right side. And in which direction the current will flow? Because the right side has become depolarized first and the left side has depolarized later. So the current will flow from right toward left. So because the current is flowing towards left, so it is left axis deviation. Yes. So the causes of left axis deviation is left bundle branch block, left ventricular hypertrophy, and inferior wall MI. The three most important causes of left axis deviation. What is the cause of right axis deviation? Important cause of right axis deviation. Right ventricular hypertrophy. And the MI of which wall of the heart will cause lateral MI? Lateral MI. Because in lateral MI, the lateral wall of the heart, which is present on the left side, is depolarized before the right side. So the current will flow from left to right, and there will be right axis deviation. For Plab 1 exam, lateral wall MI is the cause of right axis deviation, and inferior wall MI is the cause of left axis deviation. These two are important because there are some questions. Left ventricular tachycardia. In left ventricular tachycardia, which axis deviation will occur? Dr. Musarat, left ventricular tachycardia is the cause of which axis deviation? Remember that there is no such thing as left ventricular tachycardia. Right axis or left axis? Which answer I should lock? Right axis. So remember that in ventricular tachycardia, which is an arrhythmia, in ventricular tachycardia, which is an arrhythmia, extreme axis deviation occurs. Right extreme axis deviation occurs. Arrhythmia is one of the cause of extreme axis deviation. In arrhythmias, just wait a minute. In arrhythmias, let me share the screen. In ventricular arrhythmia is one of the most common cause of extreme axis deviation. Let me show you the diagram. Is it? Yes, yes. In extreme axis deviation, the one of the cause of extreme axis deviation is that the current will flow away from, the current will flow like this, away from lead 1 and away from lead AVF. So the QRS complex will be negative in both A1 and AVF, and axis will be here between 180 and minus 90 here, because it is flowing away from the lead 1 and it is also flowing away from lead AVF. So in ventricular tachycardia, the axis will be here, which we call it as extreme axis deviation or north west axis or no man's land.